Hello, so today we're doing a hair transplant. We're doing 3,000 individual hair grafts. We take out one piece of hair, we take it out from the back, and then we insert it in the front of the hairline. So let's go to the office and we'll show you this procedure. You may recognize the patient before. He works with us. So we're all done, 12 hours, a little over 3,000 grafts. Looks fantastic. This is sort of how we want it. We have little areas of tiny blood with those newly transplanted hair follicles. They're going to be very happy in their new position. You can see patients wide awake and no pain. Gets to go home and sleep it off a little bit. He's going to get really good results. Again, it's going to heal, the hairs are going to fall out, the new hairs are going to grow back in. So you got to give this time. You got to give this a good 9 to 12 months. And very, very important, having this procedure, you can see is a little woozy. You know, we've given him some pain medication, we've given him some relaxant, as well as local anesthesia, and he's had a long day, a lot of stress from the surgery. So patients cannot drive home. So if you're going to have this procedure, you've got to make sure you have a ride. You can't take an Uber, you can't take a taxi, you can't take a bus, because we can't trust them. So we got to have a significant other, friend, family relation pick you up. So that's very important.
Hello, I'm very well. Looks great. Before I had all these areas of hair missing here, the line was up here, and all this came back and grew in. It looks very natural, and I'm super happy with it. He is just the best.